So this is the day 1 PDF. I will put the PDF by day wise. And we have discussed about the bones. Yeah, this is the PDF number 2 for day 1. So this is about the name scalp. Scalp is made by 5 layers. This is the description of the layer. This is the day 2 PDF. Whatever we are discussing. Master key point, upper master point of the upper body, master point of the lower body. So the master key point of upper body, master key point of lower body. This is the day 2 PDF. Okay. So we are putting step by step. So you should not feel any, the day 3 PDF. So this is the day 3 PDF. We have discussed about the sutures, the description of the suture, then sensory area. Then this is the day 3 PDF. Now today we are going to discuss day 4. So today we are going to discuss basic point of scalp A, B, knee, C, and the Marma method of point stimulation. In the bionic scalp acupuncture, now we are going to discuss basic points. The basic points are very good for muscular problems as well as skeletal problems. The meaning of skeletal problems, like the problem of the bone, problem of the joint, osteoarthritis, osteoporosis, the problem of the vertebrae, the neck pain, back pain, spine pain, any problem happening anywhere in the bone, that is called skeletal problem, and the muscles problem. So this is the image. We are going to describe this image step by step. Yesterday we have seen this image as per Dr. Feng. We are not going into the detail right now because this is not the part of by NSA, but we will be stimulating this image by rubbing the finger here. So we'll start rubbing finger from here and we'll keep on rubbing the finger here. I will show you just now. So with the help of this, we can treat all the part, like we can treat the heart, we can treat the lungs, we can treat the liver, we can treat the gallbladder, we can treat the stomach, spleen, because all the part found in the trunk coming here. So just by rubbing the finger, we can stimulate these points. So what we can do, first we can stimulate the sensory points, right? Then we can stimulate the whole body, or we can tell in a different way. The first we are stimulating the sensory point and the brain. Then after that, we can stimulate the whole body, right? Now, if we take the image of Dr. Gio, this is the image of Dr. Gio. I will do the little explanation of this image. Even I will post the video of this image. So as per the Dr. Gio, we can see the 4 lines here. Right now, do not think the exact how the line is starting, from where the line is starting. Just I will tell you, the first line is starting from the DU20 or the top of the head. Then if we go one chun, then another lines are starting. So there are total 4 lines here. These lines are very important. I will tell you why these lines are very important. These 4 lines are very important. So I would like to show you Marma method. Before showing the Marma method, it's mandatory to tell you about these lines. So let's see here. So from the glabella, if we are going 3 chun, reaching on the hairline, then we are going 5 chun, then reaching on the DU20. So DU20 will be the first point. Dr. Gio drawing a line from here, drawing the line from here. Then one line, 1 chun anterior, then again 1 chun anterior, then again 1 chun anterior. The meaning of 1 chun is this thumb width. So from the D20, we can draw 4 lines like the D20, then one chin anterior, one chin anterior, one chin anterior. We can draw 4 lines like this. If I dip my finger in the color, suppose I'm dipping my finger in the color, one finger I'm keeping on the D20, then one chin, then one chin, then one chin anterior, and I draw 4 lines. These lines are very much important. You know why? So do like this, because you should remember everything. If you want to do the treatment for yourself, then how will you do? Keep the finger like that. This is the treatment. Sometimes we are doing like this. Sometimes we do like this. Have you done like this anytime? Today you do like this. If someone is entering in your home, you do like this. Or you do like this. And you don't respond if you're asking something. What happened? Don't respond. Then see what happened, what is happening. Then you can tell, I'm healing myself. This is the healing. Right? With the help of 4 lines. Very wonderful line. So if I'm keeping the forefinger here, this is the Dr. GIO. Dr. GIO, as per the Dr. GIO, the line on the back side will treat pain happening anywhere in the body. Pain. Upper body pain, lower body pain, middle body pain, head pain, neck pain, this pain, that pain. We are suffering with lots of pain. So the first line, the back side, we are starting counting from the back side. The first line will treat pain. So if I'm keeping my forefinger here, then my index finger will be treating the pain. And believe me, might be you have taken any fun, but believe me, just you keep your both hand like this and meditate for 3 minutes. You will get surprised with the healing effect. You will get surprised. Just before doing that, do the proper cleansing of your hands. Very, very proper cleansing. And just fold your hand in the prayerful mode. Then keep your hands here. So the line on the back side will be treating the pain as per the Dr. GIO. If you put the needle there, then it becomes scalp acupuncture. So suppose I am putting the needle here. You can see the needle. This becomes scalp acupuncture. Second line, treating the paralysis. First line is treating the pain, and second line treating the paralysis. So if I'm keeping my forefinger like this, so the back line will be treating the pain, and the second line means, as per this image, my middle finger will be treating the paralysis. So in the medical terminology, we can tell pain means sensory problem and the paralysis means motor problem. Yeah, it has exact direction. I'm coming slowly one by one. Okay. It's not random. Everything is exact. But when we are giving blessing to someone, suppose someone is coming, give me blessing. And when we are giving the blessing, before giving the blessing, we are not measuring, okay, let me check whether I'm keeping my hand. Oh, no, this is not right. Now it is perfect. No. Now, okay, perfect. Are you giving blessing in that way? No. Blessing means activation of the scalp points. So the line on the back side, that is sensory area, useful for the painful disorder. And the second line is good for paralysis, and we are using for paralysis. And whenever you are learning Chinese scalp acupuncture, during that time, you will be taught this. Chinese scalp acupuncture means the 4 lines here, the back side line is for pain, and the second line is for paralysis. Now we are having 4 fingers. The third line for this, what is this? What is this? Tremors, Parkinson. So third line will be treating tremors and the Parkinson, and there might be Parkinson in the head, Parkinson in the palm, Parkinson in the feet, tremor in the arm, writer cramps when you are signing. That is writer cramps, which is happening. The third line will be treating tremors. So first line for pain, second line for paralysis, third line for tremors. I'm not telling chorea because the patient of chorea is very rare. Chorea, very, very rare. And the mainly we are finding the patient of tremor, right? And the fourth line, the last line here, if I'm keeping my forefinger here. So first is for pain, second is for paralysis, third is for tremor, and the fourth line is for blood vessels. Wonderful line for blood vessels. Blood vessels. We are having lots of problems of the blood vessels, like the varicose veins, like the blockage in the veins, blockage in the arteries, like the arteriosclerosis. There are lots of problems happening which is connected with the blood vessels. We want to push the blood flow at some part. Here some body part is having lack amount of blood, lesser amount of blood. We can pump the blood with the help of these 4 lines. So just a 4 line. So first you should know where is DU20, and you know that. How many person knows the where is DU20? From the hairline, if you go 5 chun, that is the location of DU20. How many person knows DU20? Write down the chat box if you know the DU20. From the forehead, from the hairline, if you are going 5 chun back, that is the location of DU20. 1 chun means thumb width. So 1, 2, 3, 4, 5. 5 chun back. Or we are measuring like this is 3 chun. Then 2 chun. This is the DU20. So the first line from the DU20, second line, 1 chun anterior, third line, 1 chun anterior, 4 line, 1 chun anterior. So there are 4 lines, 1, 2, 3, and 4. With the help of this, we can treat pain, paralysis, tremors, and blood vessels. Just measure exactly. Now the question comes, the line, where is coming here? Where is the line? I will tell you only about for 2 lines because this is the geoscalp acupuncture, and I am going to stimulate with the help of Marma technique, where this much knowledge is enough, but many persons are very curious. So I will tell you. From the midpoint of eyebrow, if I draw a line to the EOP, yesterday we have learned EOP, external occipital protuberance. Then I told you we will be using this landmark for in future. So from here, from the eyebrow, midpoint of eyebrow, if I am doing the drawing the straight line till the EOP, then this line is crossing from here. This line is crossing from wherever is crossing. So suppose this line is moving like that. So we are touching the hair. From here, our sensory line will come. Okay, sensory line will come from here to here. So do the very drawing, very proper painting here. This is near about 1 chun anterior from the ear, near about 1 chun anterior from the near about. If you see from the ear, it will be near about 1 chun anterior from the ear on the front side of here. Right? So this is the sensory line. Now, so in the Murmur technique, what we are doing? So all the line in that way, all the line from here coming like here. But we are not doing discussion of the all the 4 lines right now, because now I will do the demonstration of one technique. And before doing the scalp acupuncture, do this technique for everyone, and you will be seeing greater results, excellent results without failure. And I have tried this when we are doing this before doing the scalp acupuncture. Then patient is going in the very relaxed mode, even not responding for the means not responding like a pain or nothing. He's not feeling pain. So first we are rubbing the palm and keeping over the glabella or third eye. We are keeping minimum for 30 seconds to 1 minute. And we are not giving any pressure. We are just touching very gently without applying pressure. Because this is the Marma activation. And if we apply the pressure, then it's not the Marma activation. Then it will become acupressure. And even we are not applying a little bit pressure, person will be feeling very good, very relaxed. So after doing the activation for 30 seconds to 1 minute, now we will be doing the stretching here, and we already have discussed this, the midline, and we are doing the stretching of all the sensory point. And we are pulling all the sensory point upward just by applying the pressure up one by one. We do this very slowly, very gently, without hurry and curry. And we spend minimum 5 to 10 minutes in whole procedure. Now gently we are moving to upper point. We know we are having three sensory point here, the point of eyes, nose, and mouth. So this is the uppermost point, the point of eyes. At every point, our aim to stay minimum for 30 seconds. Gently we are moving upward, reaching to the anterior hairline, where we are having point A. Point A is the point of head and neck. So we are activating this point. We are balancing the brain, we are balancing the head, nervous system. Now we are gliding our finger gently. We are not lifting the finger, just gliding the finger and coming back. So we are doing multiple stimulation and finally holding. Now, with the help of this posture, we are activating all the four area of the Dr. GIO. We are keeping the forefinger on the right side, forefinger on the left side, with the purpose that we are activating pain area, paralysis area, tremor area, and blood vessels area. So the back area on the back side, that is sensory or the pain area. The second, motor or paralysis area. Third is tremor area. And the fourth one is blood vessels area. After doing this for 1 minute, now we will be activating master key point. So we are pointing our finger, keeping on the ending of occiput, on the junction of occiput and neck. So we are keeping here. So just be a pointed finger, we are keeping there and pulling the neck upward. So this is a beautiful traction. We are putting the pointed finger and little pressure automatically applying because of the pressure of the head. We are not trying to pull, just we have kept our finger there with the little intention of traction. And our finger on the master key point of upper and lower body, means on the junction of occiput and cervical 1. This posture is very much important. We are keeping our finger here for 3 minutes. Now we are coming to the center line. Now we can see from the center line, we can see A, B, knee, and C 4 points. So from the center line, we have kept the forefinger, that is A, B, knee, and C. We are activating all the 4 points. These are the basic points. So this is the point A. We can do the rotational movement. We can do the up and down traction. We can pull the points from 2 directions and can give the reflexology here. And do the pulling or traction effect or reflexology here minimum for 30 seconds. So this is the point A, which is very good point for head and neck area. Once we know the point, then it's our choice how to activate. Now, the second point, that is the B, which is A point is 1 centimeter away, and the B point is 2 centimeters away from the central line. So now we are again giving the traction, pulling the point on both the side, doing the activation, stimulation for minimum 30 seconds. So A, B, knee. The third point, which is 3 centimeters away, that is the knee point. So we are giving the traction, doing the activation here, pulling the point upward and downward, doing the pressure here. This is a very good point for the knee pain, osteoarthritis of the knee, rheumatoid arthritis of the knee sprain, ligament tear. We can also do the rotational movement here. Now from the center line, if we are going 4 centimeters away, that is the point C, which is very good for arm. So we are doing the reflexology here, acupressure here. With the help of C point, we can treat the arm, shoulder, elbow, wrist, and finger. We can treat the arm. So in that way, whether we do rotational movement, we do reflexology, ultimately we have to activate all the point by the various method, and we will send the message to the respective part of the body. Or we can do the zigzag movement here, or we can do these all movement one by one. In the same way, all the 4 points are on the other side. In the Yamamoto scalp acupuncture, we are doing the treatment on the same side. There is no formula of the opposite side. If the person is having left side pain, then put the point on the left side, on the same side. So again, we are doing the activation of the A point to the other side. In the same way, we have done to the right, now we are doing to the left. So A centimeter is 1 centimeter away, then the B point is 2 centimeter away. Doing the stimulation of all the point like A, B, C, D, E. F, G. With the help of these basic points, we can activate whole body. So from the center line, 1 centimeter, 2 centimeter, 3 centimeter away, that is the knee point. And we are using this point for treatment of the knee pain. We can do the squeezing massage. We can do the multiple different types of the movement here. Just activate this point. We are pulling the point in both directions. The point is very, very useful. It is bringing very fast effect. Now we are going 4 centimeters away. That is the C point, which is very good point for arm. Now we are doing stretching here. We can do the stretching, pulling, pressure, needling, any method just to activate the point. So we also can do the zigzag movement, and we have seen if the person is having some problem, even our little touch, and we can see some changes there on the skin. So now when we are doing this, person is going in the very relaxed and the calm state, and we can also put the needle. Before putting the needle, we are pressing the point and just putting very little needle, very little needle. That's it. The needling on A point. Then this is the needling on B point. Then we are needling on the knee point, then the C point. We'll be learning the accurate location. So this is the Murmur point activation, right? Okay. Let's see the video number 2. So I would like to show you AB knee C point once again here. From the center line, this is the center line. So first we are drawing the center line, and we are doing the measurement with the help of this measuring scale. And we can see the centimeter mark in this scale. So from the center line, we are drawing the point 1 centimeter apart, 1 centimeter, 1 centimeter, 1 centimeter, and 1 centimeter. It's not visible, but we can understand that my intention to draw the point 1 centimeter. So from the center line, if we go 1 centimeter, that is the point A, then the B, then the knee, and then the C. A, B, knee, C. 4 points. On the other side also A, B, knee, C. These. So now first we have inserted the needle on the center line. Now from there we are going 1 centimeter apart. That is the A point. You can see I have inserted 3 needles on the A point because A point is going upward and downward. That is the B point. B point is for neck and shoulder. Then the 3 centimeter away, that is the knee point. And finally, that is the C point. For C point, we should have little more understanding, which I will show you. So this is the C point. So this was a quick demonstration of the points. So now exactly finish the ABC point properly. So let's talk about the point A. Point A, if we talk about the axis means like this. This is the x-axis and this is the y-axis. So x-axis means it's 1 centimeter bilateral from the midline. So from the midline, if you go 1 centimeter, that is the A point. Then y-axis. The meaning of y-axis, the total length, top to bottom. So the A point is having 2 centimeter length. 2 centimeter length. It is going 1 centimeter up from the hairline and 1 centimeter down from the hair. So total length is 2 centimeters. So the A point is 2 centimeter. Suppose here is the hairline. It's going 1 centimeter up and the 1 centimeter down. Uppermost point is called A1 and the lowermost point is called A8. So A point has been divided in subdivisions A1 to A8. A1, A2, A3, A4, A5, A6, A7, A8. The point coming on the hairline, that is A4, A4. So let's see here in the other image. So if we look at this image here, so this is the central line, and suppose we are talking about the A point, which is 1 centimeter away. So from the hairline, it's 1 centimeter up and the 1 centimeter down. So the total length is 2 centimeter. The uppermost point is A1 and the lowermost point is A8. So A1 to A. So A point is doing the representation of head and neck. And the neck, we are having cervical vertebra, C1, C2, C3, C4, C5, C6, C7. We are having total 7 cervical vertebrae. So the meaning of A1 is the head. Then meaning of A2 means cervical 1. Then cervical 2, 3, 4, 5, 6. In that way, the last point A8 means cervical 8. So if we see in this image, the A1 means head and brain area. Then the A2 is cervical 1, then the cervical 2, then the cervical 3, 4, 5, 6, 7. So on the hairline, cervical 3 is located on the hairline. Suppose I'm telling you 4 finger up or 3 chin up, that is the hairline. So if you are reaching here on the hairline, that is cervical 3. Now 1 to reach cervical 4, down, cervical 5, down, cervical 6, down, cervical 7, down. So the lower part is 4, 5, 6, 7. If you have the report of the patient, then you can treat accurately. Just little insertion of the needle is enough. So A point is having total 2 centimeter length, 1 centimeter up from the hairline, 1 centimeter down from the hairline, total 2 centimeter length, subdivision A1 to A8. Upper one is head, then the neck starts, head and neck. So this was the A point, right? I already demonstrated how to put the needle. Then regarding the B point, the B point is just on the hairline. It's on the natural hairline. B point, 2 centimeter bilateral, 2 centimeter away. It's just on the natural hairline. It's not like going up and going down, not like, just on the hairline. That is the knee point. That is the B point. So from the midline, if you go 2 centimeter apart, that is B point. Now B point is doing representation of the shoulder and neck. So look at this area. So A point means this much, and the B point means this. So B point means neck, shoulder. Now, if you are coming in the front collarbone, that is B point. Even you are going on the back side, scapula bone, that is also the B point. So whether we talk about the neck, shoulder bone, or the muscles, or the backside scapula bone, or the front side collarbone, these each and everything coming on the B point. Even someone is having throat pain, we can think about the B point. Okay, so B point. This was the B. A, then the B. B is just on the hairline. It's not going up, it's not going down, not like that. So now third point, that is the knee. Let's see the knee point. So knee point is 3 centimeter bilateral from the midline, and it's also on the natural hairline, just on the hairline, just a point on the hairline. That is the knee point. That is the knee. It's very good for the knee pain. It's very good for the knee pain, arthritis of the knee sprain, rheumatoid arthritis of the knee, swelling, degeneration, osteopenia, osteoporosis, any problem which is connected with the knee. Then finally, we talk about the C point. Now, regarding the C, we need little more explanation because there are further subdivisions of the C, C1 to C9. So subdivision will be discussed in the next class. But today I will tell you from the midpoint, if you are going 4 centimeter away, that is C point. So 4 to 4.5 centimeter away, that is C point. And C point is doing representation of the arm, means shoulder to arm. C point. So the problem of the arm, shoulder, frozen shoulder, tennis elbow, golfer elbow, wrist pain, numbness, any problem in the arm and finger, we can treat with the help of C point. C point will be 4 centimeter. So from here, 1, 1, 1 and 1, that is a C point. C point is slanting. So we will be discussing exact that how we can draw the C point.